Thank you, Mr. President, and through you to our colleagues. Mr. President, since this is the first time I'm rising, I want to extend my heartfelt thanks to the gentle and fierce lady from Somerville who keeps the light burning on elder affairs and long-term care and nursing homes for this entire Senate. I am grateful for her leadership and her grace and her grit. I am also grateful to the Senate President and our Chair of Ways and Means, who have both joined with the lady from Somerville to prioritize the movement of this bill. Mr. President, before I offer remarks, I also want to say that earlier this month, our Legislative Director, Brian Rossman, announced his retirement from the Senate. Now, this is his retirement after 5.5 years with our office, but certainly not his full extent of his public service, which has been remarkable. And this bill that I'm going to talk about, this amendment, has been something that Brian has focused on a great deal, both with his heart and his mind, which is Brian Rossman's sweet spot. So I rise, Mr. President, in support of Amendment 2 to stop MassHealth Estate Recovery. Many of us are familiar with the process known as estate recovery. Low-income people who receive MassHealth benefits over age 55 must repay the Commonwealth for the value of their benefits after death. While federal law mandates that some Medicaid costs be reimbursed this way, our MassHealth in Massachusetts estate recovery program currently goes way beyond the federally set floor. Federal law requires recovery only for long-term care, like nursing home care. Yet in Massachusetts, MassHealth demands repayment from families of deceased recipients who receive any Medicaid services over the age of 55, including hospital care, doctor's care, prescription drugs, physical therapy, and any other service. Again, colleagues, the federal government asks that we recover expenses for nursing homes, and we add in Massachusetts all these other expenses on top of nursing homes. This amendment would pare back our program in Massachusetts to the federally required minimum, because why should we be collecting anything more than what the federal government asks of us from among the most vulnerable people in the Commonwealth? Despite the fact that Medicaid exists to provide essential care and services to those who cannot afford it, for seniors, MassHealth benefits are essentially a loan that must be repaid by their heirs, their estate, after death. Grieving families are often caught by surprise when an exorbitant bill arrives in the mail unexpectedly shortly after the death of a loved one. I came to know about this issue from a constituent who had just that happen after his sister died. And let me tell you, it is wrenching. Most often, the process results in the forced sale of a family home. The Blue Cross Foundation did a comprehensive study of this process and concluded: 1, estate recovery perpetuates wealth disparities and intergenerational poverty, and 2, the Massachusetts program is more aggressive than most other states in the nation. The Senate passed this amendment last session in the Economic Development Bond Bill, but it did not reach the finish line. And so I am so pleased and very, very grateful to the Senate President and the Chair of Ways and Means that we have the opportunity to consider this policy again. I thank them for their support, as well as the gentle lady from Arlington whose committee advanced this bill. I also appreciate so much the stellar advocates who have fought long and hard on behalf of seniors subject to current law, and that's among them Nomita Ganguly of MassNALA, that's the National Academy of Elder Law Attorneys. She is unmatched in this advocacy. Vicky Poulos of the Mass Law Reform Institute, Charlie Carr of the Disability Policy Consortium, and AARP, whose own advocacy kicked into gear at the opportunity presented by this amendment. About 7 months ago, Mr. President, I stood in this chamber and adjourned the Senate in memory of a beloved constituent and legendary disability rights advocate, Jo Tringali, who advocated passionately for this legislation until the day he died. representing his organization, Stavros, which is in my district. Now, Joe may be subject in death to a policy he spent years fighting against. I want to thank, on his behalf and our team's behalf, the staff who have worked on this. In addition, of course, I mentioned Brian, to Monique Ching, Colby Dillon, Katie Vera, and others in Senate Ways and Means and in the Senate President's team who have looked at this and considered this legislation. I urge my colleagues to support this legislation. Thank you, Mr. President.